Good morning. Good morning. It's very quiet, almost like holy ground, sacred ground. How many people, you don't have to raise your hands if you don't want to, but are feeling invigorated this morning, spirited, more hope? I don't know, how many of you don't have to raise your hand on this one, how many of you came pretty dispirited to the conference? Pretty low, pretty things, wow, what's happening in my life? Did I hear an amen on that? I think life is full of synergies and these touch points that are intended, that are not entirely accidental. I was sitting in my office a couple of weeks ago, and Ann calls and says, Deborah, would you mind opening up a session at Regenerate? Well, I said, sure. What session would that be? She said, the one on mental health. I burst out laughing and then caught myself in a sob. And I thought, what is she? She's got some mirror, some camera on my life, that she knows that I need to be the one to come and listen and hear and be a part of this panel on mental health. And then I think there are no synergies. I think that there are synergies. There are no accidents. Last night in Austin, Texas, and I'm going to do a shout out to my daughter, Kendall Antonelli. She's co-owner with her husband of Antonelli's Cheese in Austin, Texas. And she was named the Mental Health Advocate of the Year in Austin, Texas. So again, no accidents that are out there. I also think it's extremely interesting that Bob and I realized that he was raised and born in Munster, Texas, which is just 30 miles down the road from Henrietta, Texas. Strange way that life works. I can tell you a lot about these gentlemen. You can go online and read about them, but just overall context. Together, these gentlemen have more than 80 years of experience in dealing with mental health issues, specifically mental health issues with those of us that are in the agricultural communities. Dr. Farmer got his PhD from the University of Arizona, and then spent 30 some odd years in North and South Dakota in clinical practice. Then he was a columnist, or during the overlap of this, he was a columnist for some 28 years, writing specifically about issues related to mental health in rural and agricultural communities. And one of the things I think is really interesting about his bio, he has 29 grandchildren. If there's ever somebody that needs to be in mental health, it's somebody with 29 grandchildren, right? Also, I want to let you know that added to the bookstore, Dr. Farmer bought a bunch of 3 of his publications. He will be added to the book signing today, and if you're interested in any of these publications, please go to the bookstore after you hear Dr. Farmer and purchase these and get him to sign them for you. Okay. Dr. Fetsch, my compadre from North Central Texas, was raised on a dairy farm, and then he went off to the University of Wyoming. And is that where you got your PhD? Okay, I've got to miss my notes on there. He went off to the University of Wyoming, got his PhD, and it's very interesting. He works with families in rural communities with disabilities. I asked him what that meant. Disabilities like financial disability. I wasn't sure how that word was being used. And he's working with families in our community with physical disabilities that are challenging to them in the work they do, in both a physical and emotional way. So together, ladies and gentlemen, you have 2 very experienced, heartfelt gentlemen on stage today that are going to share their experiences with us. And then we'll have a little Q&A afterwards, and then they too will be in a round table this afternoon. Dr. Fetsch.
Thank you, Deborah and Ann and Ariel, for inviting me to this auspicious occasion to talk about mental health and agriculture. As Deborah told you, I was raised on a small farm outside of Munster, Texas. And about the time I was 5, being the oldest of 5, I started doing the chores with the calves and the chickens and the cattle. Dad started the Grade A dairy. I learned a lot from him about what it takes with the record keeping and with the artificial insemination and everything else that he did. Along the way, I got more of an education, moved on, got my PhD from University of Wyoming, and have been at University of Kentucky as an extension specialist in family life for 6 years, and then here, up the road a ways at Colorado State University for 26 years. And then I supposedly retired about 8 years ago and kept on with my 3 grants. I work with farmers and ranchers with various kinds of disabilities, with hearing or back problems, and I'll bet a bunch of you have hearing and back problems already, or you might be in a wheelchair, might have amputations because of all the accidents that happen on farms. I'm the co-leader of the Colorado Agri-Ability Project, and there are 19 other states, including this state, New Mexico, where my friend and colleague Carla Wilhite and Paul Gutierrez run the program that's right here in New Mexico. We can talk more about that during the afternoon discussion if we want to. I want to talk a bit about mental health in agriculture, though, and I know there's a real problem with stigma around mental health. I'm delighted that it's on your main program and that you have a keynote on this topic. Not many conferences have a keynote on this topic, which is vitally important, especially now. I think the first step to breaking down the stigma is talking about it. I want to tell you, just to give you a brief summary of a 2-hour workshop that I love to do with farm and ranch couples and families. And I call it Recognizing Signs of Stress, Anger, Depression, Suicidal Thinking, and Making Effective Referrals. That captures a whole bunch of what I believe in and what I think is vitally essential right now. But I'm only going to give you about 6 minutes of that today. And then I'm going to ask you some questions that I want to learn from you about. And to start this, I want to tell you 2 stories. The first was about a 75-year-old man, a farmer, who was opening up his paper, and as he got to the point about obituaries, he saw that a good friend of his of 40 years had died. And he was surprised. He did not know. He hadn't talked with him in a while, so he wasn't sure about him. So he called a mutual friend and said, "I see that our friend is going to get buried tomorrow. What happened?" And the friend said, "Don't you know?" And he says, "No, I don't know." He says, "Well, he lost his wife a year ago, and he's been pretty depressed and lonely since then. And then 6 months ago, he lost the farm. So he went into a gun shop, bought a handgun, and then the young man who was selling him the gun said, 'Want to buy a box of shells?' He said, 'Just need one.' The man missed it there. The salesman missed it. So he says, 'I can't sell you one. Buy a whole box full.' So he bought a box full, went home, and used one shell. The problem with that story is that the young man did not hear the last line. The last line was, 'I only need one.' When the hair on the back of your neck goes up because you hear a friend, a neighbor, a family member say something that triggers you to feel fear about this person's future, ask about it. Ask about it, and then take action to get them to the emergency room or the family doctor. A second story I want to tell you about happened in southern Colorado. There were 2 farmers who were sitting in a local cafe for breakfast. And as they were starting to make their orders, they looked up at the door and saw a mutual friend of theirs at the door. And they waved him, "Come on, join us." So he sat down with them, and they said, "Well, how you doing? How you doing?" And he said, "Oh, fine." Did you get that? Oh, fine. Pay attention to the nonverbal. It doesn't lie, which means he wasn't doing fine. I said, "Well, what do you mean? What's going on?" He says, "Oh, things are just terrible. The government regulations and all the debt gum drought and everything else, I'm calling it quits." Another last line, to which they said, "Calling it quits? What are you talking about?" "When I get finished here, I'm going home. I got a gun. I know how to end it." Oh, boy. So this was before cell phones. So one of the 2 farmers went to the payphone, called the guy's wife, got her there, and while the other guy talked with him and listened to the guy's story. They got him in to help, and today this guy is still farming in southern Colorado. The second story depicts what I want you to hear is that if you hear a last line, pay attention to it. Ask about it. Are you thinking about killing yourself? And if so, then help them get to professional help. Pay attention to the nonverbal. Oh, fine means I'm not so fine. And listen for flat affect. Flat affect is when I just talk like this. Oh, fine, there isn't much voice modulation that goes up or down. That's a sign of depression or sickness, can be the flu too. So you got to pay attention to what's going on contextually. Well, I'd like a show of hands. How many of you know someone who is stressed out? Wow, holy moly. How many of you know of someone who's really angry? Yeah, okay. How many of you know someone who's depressed? Good grief. How many of you know someone who's suicidal? Okay, we got a problem, folks. Mental health in agriculture is a serious issue. How many of you know how to make an effective referral to a mental health professional? Good, but we've got more to learn. That's what I'm going to talk about in the next 6 minutes. And before I do that, I want to ask you men out there a question. You men out there, think about your wife, your partner, your mother, your daughter, your aunt. How do you know when she's stressed out? What's that? Because we're stressed out? Well, how do you know she's stressed out? What are the signs you can tell? What? Arms crossed. Yes, arms crossed. Probably with a chin sticking out some way. Okay. Okay, somebody else. How do you know she's stressed out? Tone of voice. Okay. What's another one? She's reading the Bible. Uh-oh. Okay, now you women. Question for you women. How do you know your husband, your partner, your grandpa, or your son is angry? How can you tell? Short with you, okay? What? Quiet, real quiet, okay? Withdrawn. Really loud, okay? Yes, those are all good signs of that. Now, all of you out there, how do you know when someone is depressed? Withdrawal, yes, that can be a sign. What? Tired, fatigued, yes, wants to stay in bed a bunch, okay? What else? Substance abuse. Often in rural settings, alcohol is the drug of choice. So you might watch for that as well. So these are all signs of high stress, high anger, high depression. We're going to talk more about this afternoon when we get to the 2 discussion groups that we have. If you're interested in that, I invite you to please join us in Salon F, which I think is this room over here. Now, what works when someone is depressed? 4 things. 1, antidepressant medication. When I am depressed, and I've been depressed at parts of my life too, it's good to go to your family physician or a psychiatrist and get on a medication that can help change the catecholamines in your brain. Depression is not just a woman's disease, as one man told me. Depression is the chemical imbalance in our brain. It's not just your thinking. It is your thinking and your feeling and your doing and your being, but good medication helps, and talking counseling, talking therapy with someone, a balanced diet and exercise. Those 4 things, most people will get better after they are depressed if they will get all 4 of those things. Now, how do you know when a friend is suicidal? You watch for signs of depression, like we talked about, and you listen for a last line. I've told you 2 of them already, only need 1, and I'm calling it quits. Some other last lines I've heard from people are, I wonder if it hurts to die. Another one is, let's have a last cigarette together. Another one I heard more recently was, I want you to know where the keys are in case something happens to me. If you hear one of those, pay attention, sit down, be eyeball to eyeball with them and listen to them and get them to help. Who is most at risk? white men 75 years old and older who lose their spouse and who lose their meaning. The first story I told you about was like that. A white man, 75 years old, who lost his spouse and who lost the farm. If you look around and you see in your neighborhood or someone like that, watch for signs of feeling lost and lonely and depressed, and pay attention to that and get them help. We've got a stigma problem around mental health, and I wish I had a nickel for every time a farmer told me, I'm not going to park my pickup in front of the mental health center, then they'll know I'm crazy. They already think it. We need to do some innovative things with regard to our mental health system to help it be more culturally sensitive. We can talk more about that this afternoon too. But before I go further, I want to ask you, when you see a family member or a friend who is depressed or suicidal, where do you look for help? Yes. A person with respect? Say it. Pastor, yes. Okay, a pastor, priest, minister, yes. Sometimes a coach, okay. Guidance counselor at the high school. Where else do you look for help? Local mental health center, okay, good. Where else? What was that? Family? Families, yes, okay. And the second question I want to ask you is, what are your best ideas for what can be done to reduce stigma and make it easier for farmers and ranchers to take good care of themselves and each other? Yes, ma'am. Talk about it with family, okay? Okay? Somebody else? Okay. We're going to talk more about that this afternoon. Well, in closing my part, I am committed to doing everything I can to help farmers and ranchers and their families and their neighbors with mental health issues. And if you too are concerned about that kind of issue, there are two things you can do. One is listen for those signs that I shared with you today. And the second is know that you can do something, because in the Farm Bill that was signed by President Trump and congressional representatives in 2018, it included FARSAN, Farm and Ranch Stress Assistance Network. Farm and Ranch Stress Assistance Network provides counseling and provides help for those of us with mental health issues. They approved $10 million a year, but only appropriated $2 million a year. So for the first year, it's just $2 million a year, and 4 regional centers are now looking for resources and asking questions like I just asked you to be able to address that. And the western region we're in here is one of them. If you want to do something about farmers' mental health, then you might want to call your representatives and ask them to increase the appropriation from $2 million to $10 million, because we can do a whole lot more with that. So reach out to your neighbors and friends and family and take care of yourselves first of all, and then take care of others as well. I thank you.
Thanks. Excuse me. Thanks, Bob. It's wonderful to share a stage with you. My voice is doing something this morning, so this isn't normally how I talk, I hope. Well, I guess I'm qualified for being 75 and older, so worry about me, okay? Especially that last comment. I appreciate very much the opportunity to be here, to be a part of this convention, and I also admire the farsightedness of the planning groups, the 3 organizations that cooperated in putting this program together to include a topic on mental health and something as scary as suicide. Bob and I counseled with farmers during the farm crisis years of the mid-'80s. I started my newspaper column in 1984 when the people in Iowa, the farmers in Iowa, decided that they were in trouble. They went to the media, and it became everybody's problem. When farmers found out it wasn't that they were failing individually, but the whole system was in trouble, that it became okay to talk about it. They did some research and found that the peak period of suicide in the Midwest was in 1982 and 83. And once the media got a hold of it, once people started talking about it, once it became a problem that everybody could share and understand, then the suicide rate dropped and there was much more awareness. The mental health system in the early 80s was pretty primitive, especially with counselors and psychologists and farm management people that had communication skills and could work with farm families around mental health topics. But there weren't many of us. And it was also the stigma of mental health was so bad that no one wanted to see one. The only effectiveness I had in a rural community was by traveling out to some town and having anybody in that town be afraid to come and see me, but all of the people from the surrounding area felt safe enough because they had anonymity. I opened up a private practice here in South Dakota, a town of 14,000, and my practice fell on its face because nobody in Huron wanted to see me. They were all interested in going to Sioux Falls where they could gain anonymity. The best place to get rural mental health services, besides trusted counselors in your own area where you have a confidential relationship, would be the nearest trade center where you have some semblance of anonymity. And that's where the mental health services need to be situated. I wanted to emphasize something else. And this afternoon, we're going to get into the weeds, I guess, with suicidal symptoms and how to help and so forth. But there are other aspects of holistic management and holistic resource management as I once knew it. Alan Savory came to South Dakota in 1986, and I was on a couple of field trips with him, and I really got to know something about this back then and how innovative and special it was when he talked about hooving and dunging and creating rotational pastures and really intensively grazing. I come back to this convention and I see you're 2 or 3 light years ahead of those days, and I'm hearing about inherding and other concepts, and I'm hearing about palatability and how bland foods are losing their taste and how processed foods are being pushed at us and they aren't that healthy. And I came away with the idea I got to be more aware of my own personal health and what I eat, and I appreciate more the idea that animals search out what's good for them and they browse and all of that was just completely new. I appreciated very much the seminar I heard on the relationships and how active this organization is, International Holistic Management, or Holistic Management International, I got it, is in helping farm families and creating people, equipping people to go out and help. Some of the things that I really gained out of that, and it's all true, you choose your life every day. You can only change yourself. And I am capable, and other people in the farm are capable of becoming a part of the whole. I like the fact that this organization, where Alan Savory took us out to a forest in the Black Hills, and it looked wonderful and beautiful, but he looked on the ground and we all saw that he said, "Where are the young?" and there was no seedlings, no undergrowth. It was barren. And he made the point that the environment needs to reproduce itself. And this organization has reproduced itself many times over, and it's split and divided into Savory Institute and this institute and all of the other cooperations. This is an organic process, and I see young couples here. I love the fact that these ideas have magnified. Now, I was a Lone Ranger in South Dakota. I was a columnist, and I was trying to make a lot of difference on my own. I had compatriots, I had coworkers, I had my spouse and other support people behind me, but it was largely my effort alone. And I was able to do a lot of good in the world, but I think if an organization wants to do a lot of good, I mean, people want to do a lot of good, they need to join an organization, contribute to it, and watch the power and it multiplies like this. So I congratulate you, I congratulate the people that started it, and it has taken hold. I also enjoyed the comments about big ears, big eyes, and small mouth. I have a friend that approached me for counseling, or no, I approached him for counseling because he needed it. And he was a good enough friend that he could take it from me, and I was probably the only person in his life that he could take it from. And one of the things that I needed to help him with was helping him have a small mouth, because he was too generous with all of his opinions and he didn't show enough understanding for others. One of the things that I teach people about farm management is that you start off with common goals. Then you need mutual trust and respect. Then you need good communications, both personally and organizationally. And you need to have the organization, the family farm, meet individual goals. It has to be a part of them. It has to energize them. They have to care about it. They need to be held accountable. And then you have a group of specialists that all cooperate together, communicate well together, and they trust each other, and they work for common goals. One of the common things that I say about farm management that people need to do is they need to manage with heart. And I'm going to spell out heart for you briefly. H, hear and understand me. Most of the people in our society, 50% of my clinical practice, had to do with teaching people how to listen, how to care, how to really understand someone. And then it sets the stage for problem solving and conflict resolution. Most people try to resolve conflict with each other without understanding each other. It takes an art to listening. There's certain skills that need to be taught. Someone needs to teach those skills. Just like at the soil nutrient level, there needs to be more awareness of what it takes to be a good listener. I know how to turn a poor listener into a good listener. Come this afternoon and find out how. Most of us could use a better listener. The next point in heart is, even if I'm wrong, don't make me wrong. And that means that be gentle with your criticisms, be constructive, and if you give them in a soft way. And if you put quotes around the wrong, people that you think have done something wrong really don't think they've done anything wrong, and your criticism falls on deaf ears, and it creates anger and conflict between you. Be very gentle in giving criticism. The A stands for appreciate the greatness within me. Most Scandinavian and Germanic farmers aren't good at giving this. They think things should be done the first time, right the first time, and it doesn't need to be taught, and the only time we need to talk about it is when something goes wrong. But the thing that's more important than almost everything on a family farm, besides the money part, is the appreciation part. That is like a second paycheck, and everybody needs to be noticed for the things that they are contributing, and they are doing well, and they want to feel part of something bigger than themselves. And to have someone notice when they are doing something well really counts. The R stands for recognize my positive intent. About 90% of people in society, I think anyway, mean well. They are trying to solve a problem, but something went wrong. And when it goes wrong, they need to be asked about it. You need to find out what they meant, and then it changes your whole demeanor about what to do and how to approach them about the mistake that was made. And the last one, the T, stands for tell me the truth with compassion. Now there's a lot of honesty here. I love the authenticity of the people that I see. It's just great. But there's a way to talk. And I talked to a rancher in South Dakota about all of the terrible conflict he was having with his 26-year-old son as they were working cattle together. And I won't tell you the words that he used to try to teach something to his son and how they were almost coming to blows. And I demonstrated to him how I wanted to talk to his son. He said, I get it, Dr. Farmer. You want me to pussyfoot around with him. And I said, that's exactly right. We're going to learn how to talk pussyfoot. And so I practiced and helped him practice. I helped his son practice. And they came back in 2 weeks, and they were getting along because they were saying the same things in much gentler fashion. I could say a lot about husband and wife relationships. The first column that was created by me and another writer was when marriage and farming clash. There's a whole thing about true farm-wife partnerships. It all starts at that level, and it's the key to holistic family management. And then it's the, let's see, where was I going with that? Oh, the multifamily farm operations. When my farm becomes ours was the second one. So that's another big issue where communications and mental health and listening and problem solving and meetings and how to run a good meeting. We can talk about all of that this afternoon. And then it's the purpose. The purpose of why we farm is so important. And the purpose gives us meaning to life. And the purpose is that the ranch, the purpose of a ranch, what is the purpose of a ranch? The purpose of a ranch is for the happiness and well-being of everyone on the ranch. That is the purpose of the ranch. It's not about cows, it's not about pounds per acre. It's about the human resources in managing an operation. And the next stage from agriculture is from production-oriented agriculture to management of human resources, and that takes a whole nother level of skill and challenge. And that's what we want to talk about today. So please come. Thank you very much.
And what I'll do.
Hard questions for Bob.
Y'all, you want to stay seated or you want to stand? Whatever.
Oh, we can stay seated, I guess.
Okay, and we'll find out. Okay, where's our first question? Right here.
So I was just curious, Dr. Farmer, why were you with Alan Savory? What was the connection there that...
When I started writing a column, I wanted to learn everything about agriculture, and so I was out taking advantage of, and I would go to farm management conferences, rural sociology conferences. I wanted to immerse myself in it, and I was hearing things clinically from people that would come to me in trouble in their farm operations, but I also had this interest in knowing what the lifestyle was, and I don't know, it was just fun.
Where's the mic? I see a question right here. Oh, I got a question right here, sorry.
I really appreciate you guys being on the platform today. January 6th, I had a high school classmate commit suicide, on a Sunday morning. And one of the things I guess I wanted to ask you about is, do you have any views about the bullying that goes on in our, in our part of our supply system, and how the farmers are impacted by that?
Bullying in the supply system, say more.
The trusted advisors that the farmers have, economically, they are pushed into making decisions that really stress them. And I think, I think it's a symptom of things that we need to maybe dig deeper with, and to help coach them through.
Okay, I hadn't thought about that before. Have you, Val?
I've attended some lending conferences and trying to help them understand how they can keep an open relationship with the farmer that comes in, and really create an atmosphere where they can solve problems together. And I also talk to the farmer about their responsibilities of being open about their lives, to plan out their meeting with the lender, have their plans together, have some confidence, and to have this shared teamwork relationship with the lender. Now, I don't know who else is doing the bullying, but one thing I do recommend is for people to get an independent assessment of their financial situation from a farm financial mediator, and they're often sponsored by the State Department of Agriculture. It's often the key to prevention of suicide, when they start to see the reality of their numbers, what their choices are, and they can't deny, they can't be in avoidance anymore, and they can start being a problem solver again. And then they have to become public. They have to overcome their pride and let others know in the community that they're hurting. They don't care who knows, they're going to come up with a solution. And so it's the openness of the farmer in terms of sharing his dilemma with other people and getting feedback, and it's also keeping the channel of communication open with the people that are trying to bully him. I don't know what you can do about the bullies other than, one person told me, if they have a relationship with a lending institution, always have a backup lender in case the first lender that you're working well with moves, or if you don't get along with the first lender, switch lenders. So get rid of the bullies.
One last question. Is there a mic somewhere right there? Okay, yes.
Hi. Oh, is this working? Thank you, both of you, for your time today. I wanted to get both of your feedback on how we can support the farm labor communities who do a lot of work in rural areas, many of them on temporary visas, where the struggle to find access to mental health care is aggravated by economic hardship, low food security, language barriers, and structural racism in healthcare.
At the University of Arizona, I counseled at a Chicano, or that was what they called it back then, mental health center, and then I worked down on the Papago Reservation for 2 years, and that's called the Owltum Reservation now by Sells, Arizona. And it was such a treat for me to be culturally aware of the people I was dealing with. I couldn't quite do it in Spanish, and so they had to have some working knowledge. It's better if you have someone that can actually speak the language, so we need more Spanish-speaking mental health professionals. I'm interested in this topic, but I don't know. It seems like it's a dead end without the mental health professionals being able to relate culturally and linguistically with the population. And they need to be cared about in other ways, perhaps.
I just want to pick up on what Val was talking about, and yes, all of those things are terribly important. Another issue Mike Roseman and I from Harlan, Iowa are working on is a training program at Colorado State University on December 3rd for professional mental health counselors. We know that there needs to be a better connection between rural behavioral health professionals and farmers and ranchers. We want to teach them and help them be more tuned in to agri-culture and how things are different on farms and ranches, and especially among Hispanic workers like you're talking about, to be more tuned into that and to think outside the box of better ways to address the needs of all peoples, especially related to behavioral health.
I work with a hog-producing family, and they have several contract farms, and they have a number of Hispanic workers, and this is in the state of Iowa. And the family is committed to the well-being of all their workers. They have key foremen that are bilingual and care, and then they consciously do a lot of things for their workforce that makes them feel a part of the workforce and cared about, and their voices are heard and they're promoted. They have training programs that get higher and higher level skills. They care about English speaking training experiences for them, and the owner of this, the owner's daughter is a HR person, and she is going out and training other farms on how to work with their Hispanic workforce.
Well, I just want to thank these two men who've come to us today on this topic of mental health with such vulnerability, authenticity, honesty, and their panel is this afternoon. And I also just want to remind you that Dr. Farmer's books will be in the bookstore this afternoon as well, or they're there now. I'm a big believer in hashtags. I just love them. I think they're a way to sort of summarize things. And in our world, in this mental health, we have two hashtags that we use. Hashtag change the conversation and hashtag no stigma in my house. I've added two more hashtags this morning after listening to these two gentlemen. Hashtag listen for last lines, and maybe my favorite, hashtag talk pussyfoot. Okay? So thank you, gentlemen. Thank you very much.